see how this is brown, different colors, rough texture, rough exterior is different than the rest. So the bottom is smooth, this is smooth, but it still has a pale appearance. But this is what happens if I don't exfoliate. So this would be build up after a couple days. Alright, and if after I brush my teeth, it'll be wet, which will make the skin soft. So from there, I try to exfoliate the rest of that, but you gotta do it when it's ready, because you could see like some of it is off, but not all of it. So if I was to pull this, of course, I would start bleeding because some of it isn't ready to come off. So that's the whole thing with exfoliative colitis. It's a buildup of dead skin, right? But it's also like you can see, to me that looks like, because of the discoloration, because of the different stuff, it could be an infection, a topical infection that's not healing because of the continuous peeling, the cycle, the continuous peeling cycle, excuse me. So this is exfoliative colitis, and it can be worse than this. I've seen way worse than this, where it's the upper lip and the bottom lip. Mine is more so the vermilion border, right from the opening of the mouth to the midway part of the lips. So yeah, man, this is what I deal with, right? So most people never even heard of this condition. It's a skin condition, but they just think like, you know what I mean, it could be coming from your use, maybe drug use, maybe an infection, STD, whatever. But you know what I mean, when you run your blood test, you go see the doctors, you see different stuff, nothing comes back. So then where does that leave the patient, right? You're supposed to go to the doctor when you're sick. When you go to the doctor and they don't have the answer, then what, right? And what kind of world is left for you? What kind of options are left for you, right? Then how can you provide for yourself? It's only by the grace of God that I was able to get a job that was remote. It's only by the grace of God that I was able to not have to be on camera every day. You know what I mean? It's only the grace of God I was able to save my money, be able to move around and go to different countries where my money is able to work for me, because I'm making enough in that country and I can still do the stuff I want to do. I can make music, I can film my videos, and this is giving me a launching pad. It's gave me a pad and able to tell my story and to connect with the people that's out there, because there's a whole YouTube community, a Reddit community. There's people out there that have this condition. You know, I've never ran into them personally, but there's thousands of people around the world that are affected by it, and they don't have no answers. Some people get cured from, you know, antibiotics, topical, oral antibiotics. Some people get cured by changing their diet. Some people get cured. It's a whole bunch of stuff, but no one way. And I don't think that the medical community is that invested in finding out, because most of them never heard of it, don't know about it, and they look at it like it's just something so minor. You know what I mean? But this can affect a person's social life and everything else that comes with it. You know what I mean? Your social life, your work life, everything, right? So yeah, this is exfoliative colitis. Once again, I just wanted to show this. So this is what it looks like if I don't exfoliate after a few days, or if it builds up. All right, so I'm going to come back. I'm going to show y'all what it looks like after exfoliation. And the exfoliation process is just wetting the lips, probably brushing my teeth, Listerine, drying it, maybe applying some type of moisturizer to it to get it softer. Or sometimes the dead skin will build up to the point where when it comes in contact with the water, it'll become like white and then soft and able to be moved around, malleable, right? But then, like I said, you got to be careful, because you could take or force too much off and then your lips start bleeding again, and that opens up the cycle for continuous healing. So yeah, all right, I'll be back. As you can see, it's got softer and it's on the peel, because like I said, this is dead skin buildup. A normal skin would peel on its own, or it wouldn't be so noticeable. It would peel over time, but you know what I mean, it wouldn't be this much buildup of dead skin. So as you can see like it's coming off, right? I'll make sure y'all can see that. And that's some skin that peeled off. Alright. And it'll be soft underneath. But like I said, sometimes it gets, like if I pull this, and you can see it's hanging on. Yeah, I don't know if y'all could get it. Like this right here, if I pull it, and you see it's hanging on, it's not ready. But I'm gonna brush it, loosen it up, and I'm gonna come back and show y'all even more when I exfoliate it. Y'all can see like a lot of the skin, it'll dry a certain way, but a lot of it is gone. That buildup, even this. You see how it just came on? So I had to peel that one. Radically, your skin exposed. Still got some remnants that could be exfoliated, but much softer, much better. But still, once it dries, after this I'll dry the lips because I don't want any moisture there, because like I said, it could be some type of infection, some type of surface or topical infection. So I'll completely dry it, then I'll apply a moisturizer to it. But this is what I'm saying about everyday process of having to keep doing the same thing, of a continuous peeling process. So you got to stay on top of it. Another thing I probably ain't even noticed, I'm gonna give y'all truth in the details. Like, you see this toothbrush? It's numbered. I number all my toothbrushes. I have about 8 of them that I use. So maybe I use one in the morning and I change the other one in the night, or whenever. If I do 3 or 4 times I brush, I'll change it. Because like I said, if it is some type of, you don't want to, I don't want to keep using the same one over and over if it is a type of infection. So that's the thing. With this is a guessing game. And your guess is as good as mine. You know what I mean? But for me, man, it's just a part of my life, my new normal right now. I'm dealing with it. And you know what I mean? I'm putting it out there because I want other people to see it. So then I could get some answers. Because there's been people that got help that fixed it, don't have the issue no more. So I need to know what the problem is, you know what I mean? Or maybe this will reach out, or this video will get to a doctor or health practitioner, traditional or, you know, conventional, and we'll see what happens. But yeah, man, this is my first time doing this. Truth is in the details. Truth over perception. That's what it is. Truth over perception, right? So regardless of what people think about me, and then they see me and they may think, oh, this person's a junkie, this person's a you know what I mean, sick, this person's whatever. I'm me. I don't know what caused this thing, but I'm just putting it out there. Hopefully I can get some answers. So truth over perception, you know what I mean? And with that, yeah, man, hopefully y'all like this video. If it's on YouTube, hopefully y'all like, comment, subscribe, follow me, come with me on my journey. If it's in the documentary, on the episodes, same thing. Just keep paying attention, you know what I mean? Give me some answers if you know what it is, something that may have helped you. And you know what I'm saying? Each one teach one, man. Nobody's better than the next person. We all dealing with something, and that's what I came to realize. This is just my something, and this is just something I'm dealing with. So it is what it is. But last time y'all could see, go around there is a difference, but you can see that it dries. It's still gonna have a film, so I just need to apply some moisturizer to it, and you know, deal with it how I deal with it, man. All right, peace.